Hi, I'm Vanessa Voss. I'm originally from California. I went to medical school at St. Louis University, and then I went to dermatology residency at Stony Brook University in New York, and then did a fellowship in micrographic surgery and dermatologic oncology at the University of Missouri in Columbia. I chose dermatology because I love that it kind of uses all different parts of my brain. We have to think very hard about the medical conditions, underlying issues that affect our patients, and at the same time, there's a lot of sort of hands-on, concrete aspects to dermatology. I love that I can sometimes go in, use my hands to cure cancer or take care of a problem for a patient right then and there. It's really rewarding and satisfying, and because so many of the issues in dermatology are so visible to patients, they're very distressing, and so being able to help with that and help patients find resolution or at least understand what's going on with their skin is very rewarding for me, and I really enjoy being able to help patients in that way. I'm a Mohs surgeon, which means I have specialty training in treating skin cancers in high-risk areas and skin cancers really anywhere in the body. I also am trained in facial reconstruction, so putting it back together after we remove that skin cancer to restore people to, looking as close to their normal selves as possible. I also work to find skin cancers, so I'm trained in what's called dermoscopy, which is a way of kind of early detection of skin cancers, looking for skin cancers in people, helping catch them early so that we can treat them so they don't become bigger problems. I also specialize in treating patients who are at higher risk for skin cancers, and that may be someone with a genetic condition or someone who is immunocompromised for whatever reason, including people who have had transplants or are on medications that dampen their immune system. Those people are at higher risk for skin cancers, and so making sure that we're closely watching them, screening them, and treating them for things that come up is one of my other areas of expertise. My goal when I first meet a patient is to try to understand what their concerns are and then try to help explain what their options are. If I'm going to be doing a procedure, as a lot of things I do involve procedures and surgeries, I like to make sure I've thoroughly explained everything about the procedure, why it's needed, why it's recommended, look at other options with the patient, make sure that they are on board, we're all on the same page, understanding what needs to happen and why, and then to make sure all their questions are answered so that they feel really comfortable with what we're going to be doing going forward. I'm really excited to be back in an academic setting. I love teaching. I really enjoy the ability to help train the younger generations, to help people who haven't ever been exposed to what we do, help them understand it, and maybe inspire them to pursue it and be able to help patients in the way that I do. I also love being in an academic center because we're able to really take care of patients who have more rare, more complex diseases. There's just so many experts here, and so being able to put all of our heads together for patients who are facing complex diseases and diagnoses is something that's really special that can be offered in an academic center, so I'm really glad to be part of that team.